Recording in progress.
Good morning. Morning to the support staff. Good morning.
Good morning, Chair.
Morning, all members.
Morning, Chair.
Chairperson, morning all.
Morning, Chair.
Good morning. I think we are about to start our meeting as we have not plenty time this morning. And let me first then use this opportunity to have a roll call to check whether all our members are here and all the stakeholders before we go to the agenda. Marcel, can you give us a roll call? Good morning.
Good morning again, Chairperson. Good morning to the Minister and all colleagues. Chairperson, we have yourself, we have Mr. Nchabaleng, Ms. Nkosi, Ms. Ndongeni, and Ms. Christians present. Thank you, Chair.
Thank you very much, Marcel. Let me then, can we fly the agenda? Can we quickly
I'll do
fly?
so now, Chair.
Okay. Okay, thank you very much, Marcel. Good morning once more to all the members and the support staff. Let me acknowledge the Honorable Minister, Honorable Deputy Minister, the department, to welcome you in this meeting. We will look at our agenda as opening and welcome, apologies, consideration of the submissions on the NHI bill. Then we'll have deliberations. Then we will then adopt our minutes. That is, and then is closure. That will be the agenda for this meeting, which is a meeting for an hour and a half from now until 9:30. Can we get a proposal for the adoption of the agenda?
Chair, can we just get clarity? What you sent to us was 8 to 8:30, as it's showing here, not 9:30.
Okay, Honorable Minister. No, that is just, the time is just, we will finish the meeting as indicated. And half an hour will be enough because we believe that the department, the time will rely on the department in terms of the response. So let me then say, maybe we not really, Honorable Minister, consider that of the duration. We will try to be specific and brief as possible. Can we agree, Minister?
Well, it's just that in terms of the preparation, but it's fine. We'll stay by, because we were given this timeline. So we tried to make sure that it's very brief. Yes. Comments from our side, as will be indicated on the advice of the letter. Yes, thank you.
Okay. Thank you very much, Honorable Minister. Thank you for that. Can we have a proposal for adoption of the agenda?
I move for the adoption, Chair. It's Nkosi.
Thank you. Seconder?
Ndongeni seconded, Chair. Morning.
Morning. Thank you very much. Apologies. We didn't receive any apologies. Can we then go to the next point to welcome the department, the Honorable Minister and the department to take us through We will not have any explanation as to this meeting is a meeting that we finalizing our engagement with the department in terms of the response of the department. Thank you very much, Honorable Minister.
Thank you very much, Chairperson. Greetings to you and to the honorable members of the committee. As I've just mentioned earlier on, this was quite a difficult assignment because on the letter we were informed that this will be the meeting will be from 8 o'clock to 8:30, and we were given a particular document which had a number of issues to which we needed to respond, as we have done. As you recall, that this is the third time that we're interacting with yourselves. I'll ask Professor Nicholas Crisp just to give our response. It will be very high level. Again, as we did previously, what the team has done is just to look at those matters, group them, and give just high level responses. And yeah, especially given the time which we're allocated to. So without any waste of time, let me invite him to give that high-level response. Thank you.
Thank you very much, Honourable Minister. Good morning to you, and good morning, Chair. Good morning, honourable members and all others present. Thanks very much. I will go directly to the presentation. So, Honourable Chair, as the Minister has indicated, it's our intention to be very brief and high level, but we are going to provide there are annexes to this presentation which provides responses to the document that was submitted for our consideration. So we'll start off by saying the purpose of this presentation is really just to give a high-level response from the department on what was provided to us regarding all the written submissions. Just by way of a summary, we note that the NCOP received a total of 106 written submissions. As indicated here, broken down from 35 were from individuals and 71 from various stakeholder groups or organizations. And there were an additional 23,465 submissions received from provinces. Some of those were electronic and others hand-delivered. And we have previously noted, but for completeness sake, these submissions have been received from a diverse set of stakeholders. As indicated, some are individuals, but also corporate entities and businesses, a variety of medical schemes and representative bodies, business associations, including BUSA, but also others. There were some regulatory bodies who also submitted submissions, and healthcare professional associations, labor unions, union federations as well, pharmaceutical representative bodies, and civil society, quite a wide range of civil society representations made as well. So what we are doing here in these few slides is just at a high level indicating what we have noted from these various submissions. So the core issues were that the implementation of national health insurance will address medical scheme challenges, we believe. National health insurance will lead to a situation where there will be no medicine stockouts at facilities. We believe that the national health insurance will lead to improvements in accessibility of healthcare services to the whole population. There will be better working conditions for health workers. There are, over time, an improvement in health infrastructure, and we did respond to this in the last meeting. The national health insurance will lead to the creation of an integrated funding pool in the health system and ensure, therefore, the realization of benefits for strategic purchasing functions. In other words, redressing the inequities that we experience presently. The national health insurance will be accompanied by better monitoring systems that's provided for, and we've addressed this in a previous presentation. It will lead to reduced cost of care because of removal of many of the duplications, and it will contribute to improvement in the state of health in the country as a whole. So, Chair, the department also notes that there has been opposition to the bill. We have noted this before, and the main issues that were raised in this particular round of what's been presented to us is, again, Same comments that the bill apparently is silent on funding. The NHI will lead to a creation of another inefficient state-owned enterprise. It was stated that the NHI is a violation of the Bill of Rights, that the NHI will create an environment that will lead to medical professionals emigrating. It's stated that the current state of public health care needs to be improved first, and the NHI will infringe on provincial powers and responsibilities. What we've done is we will add a lot of annexes where we respond to some of these allegations. We don't have time in this presentation to do so, but obviously we don't agree with those comments or oppositions that were made, which is why the department tabled the bill in the first place, because the department believes the whole purpose of the NHI is to entrench what is in the Bill of Rights, and that it is not intended to be a state-owned enterprise. It will be a public entity in terms of Schedule 3A and not a Schedule 2 entity, and that, in fact, you can't fix only the public health system when both public and private sectors are failing, and we believe the bill provides an environment where that can happen. So, Chair, considering what was submitted in this round of discussions, we have looked very carefully, as you will see in the annexes that we have submitted with the presentation. We are not convinced that there's a need for any substantive changes to anything in the bill, because it has already been through these debates several times. But there were some suggestions made in 4 areas, which we have been looking at once again. The big area that is raised several times by many different commentators as concerns is to do with governance. And there were some suggestions made for strengthening clauses related to the board and advisory committees. Now, we have, in the previous engagements with yourselves, we've said that we have already started preparing the regulations around governance, and we believe that in those regulations, all the governance issues will be dealt with. But we don't think that we should just exclude the possibility of adding some wording changes to the governance clauses at this stage. But that we need to deliberate, and in the next day or two we will make submissions to yourselves. But Honourable Chair, we're not convinced that it's really necessary to do so. The second area that's been raised repeatedly and is heavily in the media space is around medical schemes and the submissions that were made relating to Section 33. The department has looked at this from every angle, and it is the core tenet of the entire NHI is that we have a single funder model in South Africa. So the department has repeatedly said in previous engagements and says again today that Section 33 is fundamental to this bill. However, some parties have suggested alternative wordings, and we have looked at them. We will continue to look at them, and we will submit comments to yourselves once we've had a chance to discuss the implications of what's been submitted with our legal advisors. We know the word fully, or the concept or phrase fully implemented, has created debate and concern, and there have been motivations to describe that more fully in the bill. We are not sure that it is necessary to do that, because the transitional provisions, in our opinion, does create the opportunity for us to do it. But nonetheless, Chair, we did state that we would look at this more fully, and we will submit some inputs to yourselves in the next day or two. The next issue that's been raised several times in these submissions we received is the district health management officers. And there were several parties who've made inputs regarding the functioning and responsibilities of DHMOs. This too was debated at length prior to the tabling of the bill and during the process with in the National Assembly's Portfolio Committee. So obviously the department is already convinced that what is in the bill is appropriate, but in the spirit of making sure that we are not missing something, we are re-looking at exactly what parties have said, and will again, after we've discussed with the legal advisor, see whether there's anything that needs to be made clear related to the DHMOs. Then, Chair, there was one input which made a technical correction, which in fact is an error, and so we will submit this to yourselves in writing. There was the current reading of the in section that deals with the funding. There's a reference made to tax credits that are paid to medical schemes. In fact, that is not correct. The tax credits are not paid to medical schemes. They are allocated back to beneficiaries of medical schemes. It doesn't change the implication or the intent of what is in the section, but for accuracy's sake, we will submit to yourselves how to change that, what we believe would be an appropriate wording to change that sentiment. So, Chair, all other issues that were raised, we have been through, and thank you very much for the very comprehensive document that we got to respond to. Our comments are that the bill is not an implementation plan, and many of the submissions that we've received have concerns that stakeholders have around lack of detail. If one reads the Health Act or any other piece of legislation, you do not get the level of detail that many of these submissions are requesting. The details need to be provided through regulations because you need a flexible environment. You need to be able to change regulations over time because technology changes and the space within which the health system operates is constantly evolving. So one does not want to put operational and procedural issues into the legislation. And we are convinced that what is in the bill at the moment is satisfactory for the Founding Act. The department intends to consult the public when regulations are drafted. The provisions are there in the bill, as we indicated on Tuesday, and the minister is required to publish draft regulations for 3 months before and to give an opportunity to the public to make inputs and to consider any wording of any regulations. So we believe that that is the space in which all the details that most people have been asking to see in the bill should be brought into the public domain for consideration. What we do need to ensure is that we don't entrench and retain the status quo, and that is what we have been begging for in all the presentations prior today and again today. We will, as a department, listen to the mandating debate next week to get our final insights. And we are in the process of consulting our legal team, as I said, on any proposed wording. We are not strongly convinced about any wording changes at this stage, but except for the technical error that I've already indicated. But we will save any final comments until we've had the final inputs from the Select Committee. And that's everything that we have to present to you today. Thanks, Chair. Otherwise, there are annexes commenting on all the other submissions that were made. Thank you.
Thank you very much, Prof. Honorable Minister.
Back to you, Chair. That's, as I said, because also of the indicated time, we had to tailor the structuring of the presentation at this high level. But, you know, as Professor Crispus indicated, we have paid attention to the full detail of the document, and we just tried to structure the response in the categories to make it easier for reference and discussion. But please, the members must be assured of the fact that this is a very high-level summary of very detailed consideration, and we believe that possibly, as you outlined the process after the provincial mandates meeting, which we will also be listening to. We, together with all this, as I said, being the third time we are with you, we will be able to still give a consolidated input. I hope that suffices for now. Thank you very much, Honorable Chair and members.
Thank you very much, Honorable Minister. Thank you very much to the department for very much comprehensive report. Honorable Chabaleng.
Thanks, Chairperson, and good morning to participants on the platform. Let me welcome the detail, the report, the responses, and the commitment that will be given a full report with all the details that we can engage with, and that if there is any other thing that we pick in the details that may need us to engage with the department, I think the department will be available to respond to some of the things that we may need to talk to as we go forward. As Professor Crisp was responding to the inputs, he actually alleviated my fear by saying that the regulations, there will be public participation on the regulations. They'll be availed to the stakeholders for comments. I thought that they will just be done by the department and they'll follow them. So my question was going to be around that. Then I'm very happy with the presentation, and thank you very much, Chairperson. And thanks to Dr. Crisp and Professor Crisp and the team. Thank you.
Thank you very much, Honorable Chabaleng. Any further comments, members? Any further comments? Yeah, I think in terms of that note, we don't have any further comments from the members. Let me again once thank the Honorable Minister.
There's the hand of Nkosi.
Honorable Nkosi.
Thank you very much, Honorable Chairperson. Greetings to your good self, my colleagues, honorable members of the Select Committee, the Minister and his team. Honorable Chair, one would like to thank the Minister and his team for this detailed presentation. Remember, in our last meeting that we postponed, it was only because there was the information that was not on the report, on the submissions for the Free State Province. And when I look at my report now compared to the other one, it has shown that they've captured everything now and they are responding to it, and would love to thank the department for the commitment that they made to respond in all the issues that are there. And the report or the report that they are presenting to us, it's very much detailed and it's informative. So we'd love to welcome the report as they are presenting. Thank you so much.
Thank you very much, Honorable Nkosi. With the last 5 minutes which are left, Honorable Baga, you have got 1 minute.
Thank you, Chairperson. Chair, I want to welcome the presentation again by the ministry. But what I wanted to check is that in terms of what Professor Crisp has indicated, in terms of things that they still want to refine, will we get that before the next step of this legal process, or is it something that we'll get later? So I'm just saying that will that be information that is sent through before we get to the next step of the legislation process? Just that's the clarity that I wanted to get.
Professor Chris?
Let me deal with that, Chair.
Honorable Minister?
Yeah, as we've said, we would like to also benefit from further discussion I think you did outline the process which you are going to follow. So we would like to benefit from the further engagements, including the next Tuesday engagements on the provincial mandates, so that, I mean, on all the written documents, we've perused that, and where there's any further work, we'll do that. But we would like to also have the benefit of listening to the discussion on the provincial mandates. But I mean, once that has happened, we will be able to give you the final input from our side. I hope that will be in order. We're going also according to what you outlined previously as the process which you are going to follow. So, I believe that we will also be accommodated, or will be able to listen to the discussions on the provincial mandates, which will also give us a sense of any other issues which provinces or members may still be raising. And then I think soon after that, we will be able to come back to you to give you a final view from our side. Thank you.
Thank you very much, Honorable Minister. And then on that, Honorable Chabaleng is the old hand, eh? It's an old hand.
Sorry, it's an old hand, yes. Sorry.
Thank you very much. Thank you very much. Let me use this opportunity to once more thank the Honorable Minister and the department. And I want to again say that in the articulation, how you respond, it is very simple English for somebody on the street to be able to understand exactly what you are articulating. So we want to thank you for that simplifying manner. You are simplifying your responses. So once more to thank the department, Honorable Minister and the department. In closing of this meeting, our way forward is that we will have mandates from provinces. So the mandates of provinces will be as follows. So just to make sure that out of this meeting, we know where we're going, is that on Tuesday, the 14th, we will have negotiating mandates, which will be the negotiating mandates of committees of provinces. The committees of provinces will present to the select committee on their submissions that they have received and their negotiating mandate as a committee of a province. Then on the 21st, we will have final mandates that will be coming from the legislatures of all provinces, where legislatures are giving us the final mandates of the provinces. And then we'll adopt the report. So I will also just emphasize that we have extended our program as the select committee to accommodate all the provinces to make sure that we stick to the scheduled dates, which is the 14th for negotiating mandates and which is the 21st for final mandates. So on that note, let me thank everybody who is in this meeting. Members, thank you very much for the inputs. And on that note, that this meeting to be adjourned. Thank you very much.
Thank you very much, Chair.
Thank you.
Thank you, Minister.
Thank you
so much.
Thanks, Chair. Thanks, Chair.
Thank you, Chair.
Thank you.
Thank you so much, Chair. Thank you so
Bye.
much.
Thank you.
Bye, thank you.
Have a great day as KZN.